In my report, I'll be discussing the anatomical differences that make women more prone to ACL tears than men. So by the end of my report, you will know a little bit of the anatomy of the ACL, and you'll also know what the Q angle and the intercondylar notch are, and how they pertain to ACL injuries. So in the past few years, there's been an increase in women participating in athletics. And with that increase in women participating in athletics, there's also been an increase in injuries in women. And through the years, we've noticed that women tend to tear their ACLs more often than men. So it's important to understand why, so that we can better prevent this. And some of the reasons why is the anatomical differences between men and women. So to start off, I'm going to talk a little bit about the anatomy of the ACL so that you can better understand those differences. So first off, the ACL is one of the 4 main ligaments in the knee, and its purpose is to stabilize the knee as we participate in athletics or just in everyday activities. And the ACL runs right through the center of the knee, and it connects the femur and the tibia, and these are labeled on the picture that you can see. And just to orient yourself, this is a picture of someone's right knee. The ACL originates at the medial anterior aspect of the tibial plateau, and this can be shown with the blue arrow on the picture. It then runs laterally to the lateral femoral condyle, and this is shown with the red arrow on the picture. So now you know some of the anatomy of the ACL, we can have a better understanding of what the differences are between men and women that make women more prone to ACL tears. So the first anatomical difference is the Q angle. And the Q angle is a great indicator of telling whether someone's more prone to tearing their ACL or not. And the angle is between 2 measurements that we take on the leg, and the first measurement, seen with the solid black line, starts at the anterior superior iliac spine, and this is shown with the blue arrow, and it runs right down to the middle of the patella, and this is shown with the purple arrow. Now the second measurement we take is indicated with a dotted black line, and it starts at the tibial tuberosity, and it's shown with the orange arrow, and it runs through the middle of the patella, and it is shown with the green arrow. So in this picture we can see that women tend to have wider Q angles than men. And how does this pertain to ACL tears? So having the wider Q angle puts a lot more stress on the ACL because the way it is positioned. So if a man received a twisting injury to his ACL or his knee, then his ACL might just stretch. Whereas if a woman received that same injury, it might completely tear. So the next anatomical difference that make women more prone to ACL tears is the intercondylar notch. And in this picture, you can see at the distal end of the femur there are 2 bumps, and these are called the condyles, and they're circled in blue circles, and the space in between them is the intercondylar notch, and that's where the ACL runs through, as you can see in the picture. So in this next picture you can see that women tend to have a narrower intercondylar notch, and because it is narrower, the ACL is going to tend to be smaller and therefore weaker. And then you can see that the men's intercondylar notch is wider, and so it's going to be larger and stronger. And on average, men tend to have 14 millimeter larger intercondylar notch. So another reason this smaller notch could be a bad thing is that there's less room for the ACL to move. So if a man twists his knee, there's going to be more room in that notch for it to stretch. Whereas women, there's not enough room, so it might just tear. Now, it's important to understand these differences between men and women, because as we better understand the differences, we can work to prevent this injury with women athletes.